Giving birth is seriously a wild experience. Pregnancy and childbirth transform your body, sometimes in uncomfortable and weird ways. Let's talk about 5 of them. Hormone changes. You may experience mood changes or anxiety because the reality is a lot has happened to your body in the last 9 months or more. Right after giving birth, your estrogen and progesterone hormone levels drop dramatically. This can contribute to what we call the baby blues, which for everyone is different. It could be mood swings, anxiety, sadness, irritability, or even postpartum depression. Meanwhile, oxytocin, which has been called the bonding hormone, is also flooding your system. Hormones influence one another, which will affect your energy and mood. It's okay to feel all over the place with your mood for several months as your hormones eventually level out. And if you're struggling, be sure to talk to your midwife or your doctor or a counselor to discuss ways to deal and work through with these types of changes that are happening. Hair loss. Many new moms experience what feels like excessive hair loss after pregnancy. Many experience fuller, shinier locks during pregnancy, but after delivery, your hair goes back to normal. And that might mean it looks like you're losing more hair than normal. During pregnancy, higher estrogen levels keep your hair from falling out at its normal rate. So after pregnancy, when estrogen levels drop and return to normal, your hair has to kind of catch up by falling out. Hair loss peaks around 3 to 4 months after birth, but usually returns to normal by about your child's first birthday. It's important to know, though, if it feels like you're having more hair loss than expected, to talk to your clinician. Constipation. Postpartum constipation is pretty common in the first week or so because you might be a little behind in your fluids, the side effects of pain medications if you had a cesarean section, or just general fear of pushing down as this is a pretty tender area now. It can take 2 to 5 days to have a normal bowel movement. There are some women who have bowel movements on the same day. Both situations are completely normal. Many moms also worry that they will hurt stitches that have been placed, so they hold it a little longer. That can actually make things worse. To keep things moving, try to drink at least 8 glasses of water a day, especially if you're breastfeeding or pumping, plus plenty of fiber-rich fruits and vegetables. Your clinician may offer a stool softener, which is safe to take in recommended doses, even when you are breastfeeding. And try not to worry about those stitches. It's rare for them to tear, and resisting the urge to go can make you even more constipated. Just limit your strenuous activities, especially if you've had a cesarean section, as you'll probably have some restrictions. Walking around may also help with constipation. All right, for those of you who've had a vaginal delivery or even a cesarean section, what happens down there, you might ask yourself after delivery. So your uterus, it's been busy, and after you deliver, it's not quite over. While recovery from a vaginal delivery versus a cesarean section pose different challenges, there are also many similarities. Cramping, or sometimes referred to as after pains, feel oftentimes like menstrual cramps. They begin after you deliver and can last a couple days. These contractions actually help your uterus shrink back to where it was pre-pregnancy or before the baby. Over about 6 weeks, your uterus contracts to its original size, which is absolutely wild, eventually lowering itself below the pubic bone where it normally is. You'll also have a bloody discharge, kind of like your period, called lochia, for up to 6 weeks after delivery. That blood and mucus, which becomes lighter in color and flow over time, comes from the area that's about the size of your hand where the placenta was previously attached to your uterine muscle. If you had a vaginal delivery, you're almost certainly going to have a swollen, bruised, and uncomfortable perineum. The perineum is the area where the baby came out. Similarly, a C-section means a puffy belly and sometimes a painful incision. Sometimes that incision will actually be a little numb. Both areas should get gradually better over the next several weeks. Now, new pain, blood, or discharge means you really should give us a call and we can make sure that there isn't anything else going on. And not that you've been missing it, but you may wonder when your period will come back. Well, that has to do with ovulation. So if you are not breastfeeding and not pumping, you should expect to probably ovulate in the next couple weeks after delivery, which means you should get a period about 4 to 6 weeks after delivery. For women who are breastfeeding or pumping, sometimes you don't start ovulating soon after delivery. Some women do, some women don't. This is why it's really important that you make sure that you have a good plan in place moving forward to make sure your family plan is what your family plan is supposed to be. Losing pee. If sneezing, laughing, or exercising makes you pee a little in your pants in the days, weeks, and months after delivery, that's a sign that your pelvic floor could need a little bit of love and attention. The pelvic floor involves muscles, ligaments, tissue, and nerves that support your uterus, bladder, vagina, and rectum. The weight of your baby plus labor and delivery can put a lot of stress on it. If you think about it, all of that area is amazing. After pregnancy, you need to kind of retrain your pelvic floor muscles. There are exercises that we can teach you to help regain your abdominal and pelvic floor strength and heal. We also know that we have amazing pelvic floor physical therapists that can be really helpful in making sure that we've optimized your pelvic floor care after delivery. Your experiences will be unique to you. You may experience all or none of the things that we just talked about. The way the body changes after you have your baby are a lot of different words to describe. Bizarre, frustrating, amazing, inspiring, so many. You grew a human. That is crazy, amazing, wild. Your healthcare journey, we're kind of in process, right? And that's why we're here at Olmsted Medical Center to help you through what you just accomplished, growing a human, but also moving forward. You're gonna have questions, and you're gonna have questions that might be tricky. Maybe they're questions you ask your friends, your family, and maybe you don't feel comfortable talking to them about those questions. That's why we're here. So I want you to feel empowered to educate yourself on those things that, sexual function, no one wants to talk about it, but you know what? We need to talk about it. And especially after you've had a kid, especially the first time, the second time, the third time, things can be different. And it's really important for you to feel like you've got a place to go. And that's why we're here.